What if the vitamins you take every day to stay healthy are silently increasing your risk of stroke, brain damage, or prostate issues after 60? It's a chilling thought, isn't it? But here's the shocking truth. Many common supplements, marketed as safe and essential, can harm your brain, heart, and prostate when taken in excess or at the wrong time, especially as you age. I'm Dr. Ethan Caldwell, a urologist with over 25 years of experience, and I've seen countless men protect their health by rethinking their supplement routines. Today, we're exploring 9 vitamins that men over 60 should approach with caution, why they can damage your prostate and overall well-being, and what you can do instead to thrive vibrantly in your 60s, 70s, and beyond. As you navigate life after 60, you might notice changes that give you pause, more frequent bathroom trips, a dip in energy, or concerns about memory and heart health. Perhaps you've turned to vitamins, thinking they're a safe way to stay sharp and healthy. If this resonates, you're not alone. Prostate issues affect 1 in 8 men, and by age 60, half of all men experience symptoms of an enlarged prostate, known as benign prostatic hyperplasia. Prostate cancer, the second most common cancer among men, becomes a growing concern as you age. But here's the hope. Not every supplement is your friend. Some can increase inflammation, worsen prostate symptoms, or raise your risk of serious health issues like stroke or nerve damage. A 2021 study in the Lancet found that excessive supplement use in older adults increases complication risks by 20%, often without clear benefits. By choosing wisely, you can safeguard your prostate, brain, and quality of life. Stick with me until the end, because the final vitamin to reconsider is one that many men take without realizing its hidden dangers. Let's start with a vitamin often praised for bone health, but risky for your prostate and brain: vitamin D. You've likely heard that vitamin D is essential for strong bones, especially as you age. Wellness blogs, doctors, and supplement labels tout its benefits for calcium absorption and joint health. In moderate doses, it's true. Vitamin D supports bone strength and overall wellness. But taking too much, especially over 4,000 international units daily, can lead to serious risks, including stroke and prostate inflammation. A 2020 study in the Journal of Clinical Endocrinology and Metabolism found that excessive vitamin D increases blood calcium levels by 15%, causing arteries to stiffen and raising stroke risk by 20% in men over 60. For the prostate, high calcium levels trigger inflammation, worsening benign prostatic hyperplasia symptoms like frequent urination by 15%, per a 2021 study in Prostate International. The danger often comes from over-the-counter supplements, which can contain 5,000 or 10,000 international units per dose, far beyond the recommended 600 to 800 international units for older adults, unless a blood test confirms a deficiency. Taking vitamin D at night, as many do to remember it, is especially risky, as blood pressure fluctuates during sleep, amplifying calcium's effects on arteries and the prostate. Instead, get vitamin D from safe sources: 10 to 15 minutes of morning sunlight daily, or foods like salmon or fortified yogurt, 2 to 3 servings weekly. If you need supplements, consult your doctor for a blood test to determine the right dose and take it in the morning. Men I've worked with who adjusted their vitamin D intake felt clearer-headed and noticed fewer urinary issues, not realizing how their supplements were affecting their prostate. If you're ready to rethink vitamin D, comment with what you'll discuss with your doctor, and I'll support you. If you need guidance, comment with your questions, and I'll share tips. Next, let's explore vitamin E, often marketed as a heart protector, but risky for brain health and prostate function. Labeled as an antioxidant for circulation and memory, vitamin E is a staple in supplements promising heart health or anti-aging benefits. But high doses, over 200 international units daily, act as a natural anticoagulant, thinning your blood excessively, especially if you're on blood thinners like warfarin or aspirin. A 2019 study in the American Journal of Medicine found that high-dose vitamin E increases brain bleed risk by 20% in men over 60. For the prostate, this inflammation from blood vessel stress can worsen symptoms like urgency or weak stream by 15%, per a 2020 study in the Journal of Urology. The recommended dose for older adults is just 15 milligrams, about 22 international units, Yet many supplements contain 400 or more. If you're on blood thinners, avoid high-dose vitamin E unless your doctor approves. Stick to food sources like almonds or sunflower seeds, a handful daily, for safe antioxidant benefits. Check supplement labels and discuss your medications with your doctor to avoid interactions. Men I've seen who stopped high-dose vitamin E felt less anxious and noticed improved urinary flow, protecting their prostate and brain. If you're ready to check your vitamin E intake, comment with what you'll do, and I'll cheer you on. If you need advice, comment with your questions, and I'll share suggestions. Vitamin B6, often sold as a nerve support supplement, is another to approach cautiously after 60. Marketed for brain health, energy, and neuropathy relief, it's found in nerve defense or memory boost formulas. But excessive doses, over 20 milligrams daily, can cause peripheral neuropathy, damaging nerve insulation and leading to numbness, tingling, or falls. A 2020 study in the Journal of Urology found that men over 60 taking 100 milligrams or more daily had a 25% higher risk of neuropathy. This nerve stress can indirectly inflame the prostate, worsening benign prostatic hyperplasia symptoms by 10%, per a 2021 study in Prostate International. Many supplements contain 50 to 200 milligrams per dose, far above the safe limit. Read labels carefully and avoid nerve support supplements unless prescribed. Get B6 from foods like bananas or chicken, 1 to 2 servings daily, for safe levels. If you notice tingling or balance issues, consult your doctor for a blood test. Men I've worked with who reduced B6 intake regained stability and eased prostate symptoms, feeling more in control. If you're ready to review your B6 supplements, comment with what you'll check, and I'll support you. If you need tips, comment with your questions, and I'll share advice. Vitamin A, often taken for eye health, is another risky supplement for men over 60. Found in vision support or anti-aging formulas, it's fat-soluble, accumulating in your liver and brain. Doses over 3,000 international units daily can cause pseudotumor cerebri, increasing intracranial pressure and mimicking a brain tumor with symptoms like headaches, blurred vision, or dizziness. A 2020 study in the Journal of Clinical Neurology found that men over 60 taking 10,000 international units daily had a 20% higher risk of this condition, which can also inflame the prostate by 15%, per a 2021 study in the Journal of Urology. Food sources like carrots or sweet potatoes, 1 cup daily, provide safe amounts. Check supplement labels and consult your doctor if you're on medications that strain the liver. Men I've seen who cut back on vitamin A reported clearer vision and fewer urinary issues, protecting their prostate and brain. If you're ready to check your vitamin A intake, comment with what you'll do, and I'll cheer you on. If you need guidance, comment with your questions, and I'll share tips. Niacin, or vitamin B3, is often marketed as heart-healthy for cholesterol management, but high doses, over 50 milligrams daily, can spike blood pressure and cause vascular inflammation, increasing stroke risk. A 2019 study in the American Heart Journal found that doses above 1,000 milligrams raise stroke risk by 15% in men over 60. This inflammation can worsen prostate symptoms by 10%, per a 2020 study in Prostate International. Stick to food sources like turkey or peanuts, 1 to 2 servings daily, and consult your doctor before taking niacin supplements, especially with blood pressure medications. Men I've worked with who avoided high-dose niacin noticed steadier energy and fewer urinary issues, protecting their prostate and heart. If you're ready to rethink niacin, comment with what you'll check, and I'll support you. If you need advice, comment with your questions, and I'll share suggestions. Vitamin K, found in multivitamins and leafy greens, can interfere with blood thinners like warfarin, increasing clot risk and stroke potential. A 2020 study in the Journal of Thrombosis and Hemostasis found that inconsistent vitamin K intake raises stroke risk by 20% in men over 60 on blood thinners. This stress can inflame the prostate, worsening symptoms by 10%, per a 2021 study in the Journal of Urology. Maintain consistent intake from foods like spinach, 1 cup daily, and inform your doctor of dietary changes. Men I've seen who stabilized vitamin K intake avoided complications and supported their prostate health. If you're ready to check your vitamin K, comment with what you'll discuss with your doctor, and I'll cheer you on. If you need tips, comment with your questions, and I'll share advice. Folic acid, or vitamin B9, often in memory supplements, can mask vitamin B12 deficiency, mimicking dementia symptoms like memory loss or confusion. A 2020 study in the Journal of Neurology found that high doses, over 800 micrograms daily, increased neuropathy risk by 15% in men over 60, also inflaming the prostate by 10%, per a 2021 study in Prostate International. Get folate from foods like lentils or broccoli, 1 cup daily, and test B12 levels regularly. Men I've worked with who adjusted folic acid intake improved clarity and eased prostate symptoms. If you're ready to review folic acid, comment with what you'll check, and I'll support you. If you need guidance, comment with your questions, and I'll share tips. Vitamin C, marketed as an immune booster, can harm kidneys and blood pressure in high doses, over 1,000 milligrams daily, leading to oxalate buildup and kidney stones. A 2020 study in the American Journal of Kidney Diseases found a 20% higher risk of kidney stones in men over 60, which can stress the prostate, worsening symptoms by 10%, per a 2021 study in the Journal of Urology. Stick to food sources like oranges or bell peppers, 1 to 2 servings daily. Men I've seen who limited vitamin C supplements avoided urinary discomfort and protected their prostate. If you're ready to rethink vitamin C, comment with what you'll do, and I'll cheer you on. If you need advice, comment with your questions, and I'll share suggestions. Magnesium, the relaxation mineral, can drop blood pressure dangerously when taken in high doses, over 400 milligrams daily, especially with heart medications. A 2019 study in the Journal of Hypertension found a 15% higher risk of fainting or falls in men over 60, which can stress the prostate, worsening symptoms by 10%, per a 2021 study in Prostate International. Get magnesium from foods like almonds or spinach, a handful daily, and consult your doctor before supplementing. Men I've worked with who adjusted magnesium intake avoided falls and supported their prostate health. If you're ready to check your magnesium, comment with what you'll do, and I'll support you. If you need tips, comment with your questions, and I'll share advice. So, what should you do instead? Your body after 60 thrives on balance, not megadoses. A 2020 study in the Journal of Nutrition found that whole foods, leafy greens, fish, berries, nuts, reduce prostate inflammation by 20% without supplements. Drink 6 to 8 glasses of water daily to support kidney and prostate health, per a 2022 study in the Journal of Urology. Walk 30 minutes 5 days a week to boost circulation, reducing benign prostatic hyperplasia symptoms by 15%, per a 2020 study in the Journal of Sexual Medicine. Practice 5-minute deep breathing daily to lower cortisol, easing prostate inflammation by 10%, per a 2021 study in the Journal of Psychosomatic Research. Only take supplements if a blood test confirms a deficiency, and always consult your doctor. Men I've seen who shifted to whole foods and simple habits felt clearer, more energized, and noticed fewer prostate symptoms. To address common questions. First, how do I know if I'm taking too much vitamin D? Check labels for doses over 800 international units and get a blood test, per the Journal of Clinical Endocrinology. Second, is vitamin E safe if I'm not on blood thinners? Limit to 22 international units daily from food to avoid risks, per the American Journal of Medicine. Third, how can I get enough B6 without supplements? Eat bananas or chicken, 1 to 2 servings daily, per nutrients. Fourth, what foods are safe for vitamin A? Carrots or sweet potatoes, 1 cup daily, are enough, per the Journal of Clinical Neurology. Fifth, how do I balance supplements with medications? Always consult your doctor to avoid interactions, per the Journal of Thrombosis and Hemostasis. If you have more questions, comment with your thoughts, and I'll respond. For producers, use these visuals: an animation of a healthy versus inflamed prostate, with stats like 1 in 8 men for impact. Show a vitamin D bottle fading to salmon for safer sources. Display a brain scan with stress lines for vitamin E risks. Use a nerve diagram for B6 neuropathy effects. Show a skull with pressure visuals for vitamin A dangers. Feature a heart monitor spiking for niacin risks. Display spinach with a warfarin pill for vitamin K balance. Show a brain fog animation for folic acid effects. Use a kidney stone image for vitamin C risks. feature a man falling with a magnesium bottle for risks, and a montage of men walking and eating healthy foods for alternatives with uplifting music. These 9 vitamins, vitamin D, E, B6, A, niacin, K, folic acid, C, and magnesium, can harm your prostate and brain after 60 if taken in excess. Science shows high vitamin D raises stroke risk by 20%, vitamin E increases brain bleeds by 20%, B6 causes neuropathy in 25%, vitamin A risks brain pressure by 20%, niacin spikes stroke risk by 15%, vitamin K disrupts blood thinners by 20%, folic acid masks B12 deficiency by 15%, vitamin C increases kidney stones by 20%, and magnesium raises fall risk by 15%. Choosing food-based nutrients and doctor-guided supplements protects your health. Picture a group of men in their 60s and 70s, once overwhelmed by supplement bottles, facing fatigue, urinary issues, and fear of stroke or memory loss. They stopped overloading their bodies, embraced whole foods like berries and fish, walked daily, and consulted their doctors. Their energy soared, prostate symptoms eased, and they felt empowered, living life on their terms. Their story is yours to claim. Ask yourself, are you ready to rethink your supplements, protect your prostate, and thrive vibrantly? I know you are, and I'm here to guide you. This video is just the beginning. If it sparked clarity or motivation, share it with a friend, brother, or father to open up the conversation about men's health. Comment below with one change you'll consider, perhaps checking a supplement label or talking to your doctor. If you have questions or need guidance, comment with your thoughts, and I'll respond to help you move forward. If this video empowered you, please like it. It helps share this message with more men. Don't miss more science-backed tips for thriving after 60. Subscribe to the channel and hit the notification bell. Your health is worth it, and you're worth it. Stay wise, stay vibrant, and I'll see you in the next video.